Obviously, Dr. Paradis and I are here today to convince you to come to our practice for a consultation. All our consultations are complimentary, so we try to remove that hurdle for you coming to see us to get great dental care. But what do you think it is about our specialty and about you and me as individuals that we could tell our patients, what separates us from the pack?
Yeah, well, one of the things I think is critical about prosthodontics is that it is the specialty of dentistry that really emphasizes actual patient dental treatment, fixing teeth properly, fixing mouths properly, and replacing missing teeth properly. We're the only specialty that's trained to do those things. Well, this specialty actually is part of general dental education, and traditionally in dental school, dentists spend a great deal of time learning how to make the prosthetics that they are going to install in patients' mouths. The problem is we quickly realize when we graduate from dental school that we have glossed over the details that really are critical to establishing the ability to deliver good quality dental care. Now, some young dentists are talented and can pick up these skills instantly. Others may never develop the skills that it takes to deliver proper dental care. I quickly realized when graduating from dental school, as did Dr. McFadden, that the dental education is inadequate to really practice dentistry at the level that it can be practiced. And by that I mean the diagnosis of patients' conditions and applying the proper treatment in a way that will give patients long-lasting comfort and durability. So prosthodontics trains us kind of from the beginning of the actual skills that are needed to deliver prosthetic dentistry and establish good treatments in patients' mouths.
There's a couple adages that come to mind for me. I used to believe that the adage, practice makes perfect. And I think all of you will understand that it's not just the practice that makes somebody better at their particular endeavor, but it's trying to get better with every day, every procedure, and hone your skills. That's how you actually get better. Practicing poorly or quickly and not trying to hone your skills really doesn't make you a better doctor in the long run. It really just makes you faster. And it's nice to be faster, but again, our practices are built on as long as it takes to make it right. So Malcolm Gladwell's books, in a couple of his books, he talks about 10,000 hours to become an expert at something. And I think our laboratory background really facilitated our 10,000 hours in a very quick way, because we actually made all of these prostheses ourselves for many years early in our career. And we still do a lot of the lab work ourselves to this day because we want it to be right for our patients.